Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Let me introduce myself. My name is Restu Aulia Rania Pramana. In this opportunity, I would like to present and share my answer regarding speaking final exam. Uh, from the questions that were provided, I choose the number 3 to be answered. And the question is, during the pandemic, the government sets up policy that people above 60 are given priority in getting vaccinated. Um, do you agree? Why? Why not? So here is my answer. In my own opinion, and supported by some sources, of course, I agree with the government policy that people above 60 should be given priority in getting vaccination. All of us know that vaccination is a government operation to reduce risk and break the COVID-19 spread chain. Vaccines work in various ways and provide the benefit for individuals and communities. The obvious benefit of a vaccine is to prevent infection in people who have been vaccinated, reduce the number of viruses in a person who has ever been infected, and also can reduce the possibility of transmitting the virus from one person to another. Uh, the Indonesian government has ordered 270 million doses of the vaccine and continues to vaccinate the society. The target of vaccination to increase immunity is around 70% of Indonesian total population based on how many people are targeted. It minus the comorbid, former COVID-19 patient, pregnant and lactating mothers. The health minister also, Budi Gunadi Sadikin, gave the green light or agreed to the vaccination for the elderly on 7th February 2021 after receiving information from the Food and Drug Administration or BPOM. We know that the public might think prioritizing vaccine for older people is a bad idea. They said, why give a vaccine to people who it won't work as well? But we should explore older people as the priority group for several reasons. There are two reasons why I think it's a good idea for the elderly to be prioritized in the vaccination program. The first reason is the elderly is the age group who have comorbidity disease, which are hypertension, stroke, heart disease, diabetes, and chronic kidney disease. Once they have been exposed, they can hardly to be helped, and their lives are relatively difficult to save. The cases or severe disease in older people could have a big impact on that. And the second reason, as we get older, our immune cells can become more difficult to activate in response to the natural aging process or other factors like chronic inflammation. Uh, as a result, vaccines often don't protect older people as well as younger people. The elderly who are over 60 years old have a weak immune system, so they are susceptible to viruses. Even though during the pandemic they always adhered the health protocol like staying at home, using mask, but they are easily infected by their closer relatives, both someone with symptoms or without symptoms. For example, their child or their family. So, considering the basis, the government must continue to focus on the vaccination program and, of course, give priority to vaccination for the elderly to reduce and even prevent the indicators mentioned from the occurring. Therefore, I strongly support and agree that the priority of vaccines should be given to the elderly. Uh, I think that's all from my answer. So, thank you. Wassalamualaikum warahmatullahi wabarakatuh.